Okay, so I want to talk a little bit about movement and how I approach a movement, or how I approach movement. So first, I approach movement by looking at the entire body, not just the area that hurts. I'll say this a couple times. The area that hurts is often in pain because it's overworked because somewhere else isn't working like it should. You know, compensation. Really, you can sum that up with compensation. Our bodies are so great at compensating that if all you do is treat pain, you're gonna have a really hard time finding a long-term solution to the problem. It's fine. The way to treat pain is find where the root cause of the problem actually is and fix that. Which oftentimes, again, it's very, very rare that the area that hurts is the actual root cause of the problem. So let me show you how I approach a movement. So we start by going feet together. We start by looking at the neck. So if you go chin to your chest, try to reach down, touch your chin to your chest. Is there any tightness? Is there any discomfort? Is there pain? What do you feel with that movement? Next, we go and look up. Same thing. Any tightness, pain, discomfort. So there we have two movements. We've got neck flexion, neck extension. Then we look at rotation left, rotation right. And we compare those two. Does left feel different than right? Is there any tightness, discomfort, pain, anything? What do you feel? And from that point, we can start identifying, okay, we can take gravity out of the equation, so we can do these same exact movements with you lying down on your back. Does it, like, let's assume that you have some discomfort when you look left when you rotate your head left. Well, I don't know what the problem is other than there's some discomfort there. But I can start to identify, if I lay you on your back and have you rotate your head, does it feel better? Does it look better? If that's the case, if let's say you have pain here, you lay on your back, you rotate your head left, and it opens right up and it's pain-free, I know you have a stability problem that needs to be fixed. We need to work on left neck rotation, stability. And so we can start to identify, is there a mobility problem? Let's say you lay down on your back and you rotate your head left, but it's still painful, it's still tight, it's still some discomfort. Then I know you have a mobility problem that we need to start treating right away. Okay, so the next thing is we can look at the shoulders. We do the same concept. So we go arm behind our back. Can you touch the opposite shoulder blade? Arm behind the back. Can you touch the opposite shoulder blade? Do they feel different? Does one feel tight, discomfort, or painful? Now what this movement does is it brings two different movements into one. So with the shoulder, by doing this, we're getting shoulder extension, but we're also getting shoulder internal rotation. So if you have pain, discomfort, tightness here, I don't know what the problem is until I look at it, look at those movements individually. So I need to say, okay, is there a shoulder extension problem? Is there a shoulder internal rotation problem? And that requires me laying you on your stomach and looking at your shoulder. The thoracic spine also plays a role in this movement, so we would have to address that as well if that's a problem. Opposite side, so same thing. And then we go arms up overhead. Okay, is there any tightness, discomfort, pain? And I'm a little bit tight in that direction. And that really takes shoulder flexion. It also takes shoulder external rotation. And again, I don't know where the problem is. Just by looking here, I have to lay you down. Is it mobility? Is there a stability problem? And where is it actually coming from? Is it coming from the flexion? Is it coming from the rotation? Or it can be coming from the spine where the root cause of the problem actually is. The next one we want to look at is toe touch. Can you touch your toes? Is there a pull in your lower back? There should be no pull in your low back. You should just feel some slight hamstring stretching there. That's completely normal. But again, if this hurts or it's discomfort or you can't go all the way down, I don't know where the problem is, because what happens here is we have spine flexion, but we also have hip flexion. So we have to dive into those and say, okay, where is the root cause of the problem actually coming from? Next one, if I rotate left and rotate right, does one side feel different? Does it look different? Painful, discomfort, tightness. And again, in order for you to rotate, it takes ankle rotation, it takes hip rotation, and it takes spine rotation. So we have to dive into all three of those. If this doesn't look right, or it feels painful, or tightness, we'd have to dive into all three of those areas to see where the root cause of the problem actually is. And the next one is bending backwards. Let me get to the side here. Bending backwards. Is there low back tightness, which there should not be? And then do you have the full amount of mobility? And that takes hip extension. It also takes back extension. So again, I don't know where the problem is if I don't dive into each of those, if there is some tightness, pain, discomfort with that movement. Next one we do is we look at balance. Can you hold here for 10 seconds without being wobbly? Same thing, 10 seconds on the opposite side without wobbling. And that takes hip and core and ankle stability. And again, I don't know where the problem is. If it's not, if you're wobbling all over the place, I don't know where the problem is. I know there's a problem, but it could be your ankle, it could be your hip, or it could be your core. And we have to identify where the actual root cause of the problem is coming from. And then lastly is just a squat. So that takes hip flexion, takes low back flexion, it takes upper back extension. And so we have to dive into that. Okay, so I hope this didn't confuse you more, but I want to just let you know that the area that hurts oftentimes is in pain because somewhere else isn't working like it should. And in order to find the real root cause of the problem, it's not about saying, okay, does that hurt? Well, let's fix that where that pain's at. That just doesn't work. In the short term, it might work, but long term, we have to identify what movements hurt, what movements are tight, what movements are discomforting, and find out, is there a mobility problem in that area of the body? Is there a stability problem in that area of the body? And treat that outside of just treating pain.